dire warnings from the World Health Organization in an attempt to ward off a massive humanitarian catastrophe.
And the number one priority is to get really this influx, the humanitarian corridor for life-saving medical supplies, first and foremost oxygen. Let's not forget that Ukraine has 3 superimposed emergencies. Number 1 is still the COVID-19. People need life-saving oxygen. Number 2 are outbreaks of poliomyelitis. And the third one is the military conflict.
Klug's warnings bring to mind the desperate plight of millions in the Middle East, in Syria, Iraq, Afghanistan, Yemen, and other countries.
In broadcasting, in TV, in social media, terrible news from Ukraine, and it looks like something what had happened previously in Syria or in Iraq or some other place.
Those comparisons are relevant as Russia's ongoing assaults destroy more and more vital infrastructure. Alarming signs of a breakdown in support systems are predictable. Food security, water, sanitation, housing, healthcare, and education are all at risk. Another sign, the repeated displacement of civilians is already underway. For Syrian student Orwa Steif, it's like déjà vu. He knows all too well how humanitarian disasters can unfold.
It's the war, wherever I crisis all over the world, and those places that I've been in Lebanon had economic crisis. I had to flee the country also. As well now Ukraine, it reminds me of Syria a lot. The Syrian war, it has a lot of similarities with the war in Ukraine.
He's been uprooted by them more than once in the last 10 years. And he knows a humanitarian corridor won't put a stop to the bombings and fighting, and that an escalation of this crisis could lead tens of millions still inside the country to suffer the same fate as him. Sarah Balter, TRT World.